Today, I was exposed to COVID-19. It could have been when I had lunch with my mom and uncle. We had our masks on at our house, but we took them off to eat. It could have been when I stopped at my sister's house to drop off a book. I had my mask on, but she did not. It could have been when I gave my cousin a ride to the store. We both wore masks, but I later found out that I should not ride in a vehicle with anyone that does not live in the same house as I do. It could have been at work. My coworker doesn't always wear her mask properly, as she finds it hard to breathe sometimes. I stopped saying anything because I want her to be comfortable, and I always have mine on. Maybe it was on a surface that I touched sometime during the day. The problem is, sometimes it's really hard to know. Over the next few days, I was very busy. I went to a family barbecue to celebrate my grandma's birthday. She turned 86. Her health has not been too good, so we all wanted to spend some time with her. We felt having something outside was a safe way to go. During the interview after I tested positive, I realized I had really put my whole family at risk. Not all of us wore masks because we were outside, and we all ate at the same table with lots of talking and laughing as we shared memories. I spent the night out of town at my sister's house, so I did not have to drive to a meeting for work early in the morning on Friday. And then after the meeting, I had drinks with some friends to catch up. On the sixth day, I woke up with a headache and chills. Later that day, my cough started. I called the COVID-19 hotline and was instructed to contact my primary care provider to get tested. I went in for my test the next morning and found out that I was positive for COVID-19. I was then put in touch with the public health nurse to begin contact tracing and get COVID-19 education and support. After my interview with the public health nurse, I realized I had potentially exposed 25 people that I loved and cared about. My symptoms definitely got worse before I started to feel better. To keep my family safe, I self-isolated to one room of our house during my quarantine. I only left for a doctor's appointment. I made sure to wear my mask if there was any possibility of coming into contact with someone else, and I made sure I washed my hands and cleaned surfaces often. Unfortunately, the most damage was done before my symptoms appeared. Other family members became sick too. My grandma had to go to the hospital by ambulance, and I'm not sure if she'll ever come home. Please continue to social distance by staying 6 feet away from other people and wear a mask when out in public and around individuals who do not live in the same house as you do. Avoid touching your face and wash your hands often. Make sure to clean shared surfaces several times per day. These simple measures can help keep our loved ones safe.